Before ever seeing a practitioner, the traditional patient goes to a medical facility where there is support staff and lots of equipment. This sets the stage for the patient that they are about to experience a quality medical visit before they ever actually see the practitioner. The virtual patient doesn't have the same surrounding transition before a visit. The virtual patient gathers clues in other ways, beginning with the background they see on the screen. Is it professional in color scheme and setting, or is it cluttered or overbright? The practitioner may be the first person the patient sees in a virtual visit. Is this person relaxed and looking at the patient, or do they shift in their chair and look away from the camera at some unknown object? Anything that distracts the patient from the practitioner and the purpose of the virtual visit can produce a negative perception of their visit. The virtual practitioner needs to be aware that even seemingly small distractions can be amplified over video.
Hello. Can you tell me how taking your medication is going?
It's going fairly well.
Would you say that your use of metformin has been... Hi, how are you doing?
Fine, how about you?
Good.
Oh, I see you're busy.
Yeah.
Okay.
Would you say your use of metformin has been as prescribed, increased, or decreased? Or about the same?
About the same. I missed a couple doses.
So you would say you missed 2 doses of metformin? Sorry, what was your answer? Did you miss 2 doses of metformin?
Yes.
Okay. To help me better understand how you feel about taking metformin, I'd like to ask you a couple of questions. What problems are you having with taking the medication? Are you having any side effects, forgetfulness, fatigue?
Well, it makes me a little queasy.
Queasy. Can you tell me about specific examples?
The goal of a good virtual visit is to gather adequate information for diagnosis or intervention while creating a positive experience for the patient. A positive experience is created when everyone is as physically and mentally comfortable as possible. This includes assuring patient privacy, maintaining good eye contact, or letting the patient know why you have to look away, keeping positive body language, allowing the patient time to respond and ask questions, and minimizing distractions. See how reducing distractions changed this virtual visit.
It's good to see you this morning. Today we're going to talk a little bit about your medications. I'm going to ask you a few questions, and I've got my EMR over here, so if you see me looking away, it's because I'm looking at my EMR, and I'll be typing some things in so I can take good notes. Can you describe your routine for taking your medication? Do you take it as prescribed? Have you increased your dosage, possibly decreased your dosage?
Well, I've done most of it, but I have missed a couple times.
Okay, so you've missed about two doses then, is that correct? Okay, 2 doses. I am particularly interested in any side effects you might be experiencing, any forgetfulness that you might be experiencing. Are either of these a problem for you?
I sometimes get queasy.
Describe that a little bit more, kind of when and where this happens.
It's really more when I take the medicine than, like later on.
You're experiencing problems that are real common to some of my other patients. The extended release doesn't have quite that same fishy smell and taste that people complain about. Would you be interested in trying the extended release version when you're done with this particular prescription after we get you through this first cycle?
The virtual visit can be positive or negative. Which will you create?